This year, an estimated 290,000 Americans will be diagnosed with breast cancer, and nearly 151,000 will learn that they have colorectal cancer. As we mark World Cancer Day tomorrow, doctors are urging you to get screened today. Dr. Bharti Jasra and Dr. Meghan Daly are with UF Health. They're both joining us this morning with some critical information about prevention. So, Dr. Jasra, let me start with you. You specialize obviously in breast cancer. This type of cancer gets a lot of attention. What do you think are the two most critical components to catching this early?
I think first most important thing is being breast aware, meaning knowing how your breast skin and nipple areola and feeling your own breast, knowing that. And the second thing I'm going to say is screening in time, screening for breast cancer.
So, of course, self-exams are important, and, of course, a yearly mammogram. And I want to talk to you in just a moment a little bit about risk factors. But let me bring Dr. Daly into the conversation. Who would you say is most at risk of developing colorectal cancer, doctor?
Sure. So we know that the updated guidelines recommend anyone of 45 years of age or older to undergo screening. If you have a family member, so a first-degree relative that's had a history of colon or rectal cancer, those individuals should start screening at age 40 or 10 years before the earliest case, whichever comes first.
And how much of this is about asking, doctor, important questions also of risk factors? Because sometimes, people maybe are not in touch with relatives and they just don't even realize that the risk exists.
Sure. Taking a good history and physical is critical, and certainly any change in their bowel habits. So if they're having blood noticed in the stools, a change in the consistency or the caliber of those, that should prompt a screening colonoscopy if that hasn't been performed recently.
So oftentimes, and Dr. Jasra, I'm sure that you have heard this from patients. So oftentimes they just assume that nothing is wrong. They might spot some things that raise a question, but women in particular get very busy in life, and they tend to not be fantastic about taking care of themselves because they're so concerned about taking care of their family. That said, what are the risk factors of breast cancer that you feel that women who are watching, and men as well, need to be aware of this morning?
See, the most common risk factor is being a woman and getting older. And most of the women actually who get diagnosed with breast cancer have no family history of breast cancer. And that's a surprise to them. They're like, oh, first thing they say is, oh, we have no family history. The modifiable risk factors is smoking, alcohol, obesity, exposure to hormones.
And Dr. Daly, I mean, cancer is cancer, right? And we know what the risks are. Probably those risk factors are not that different in terms of how you take care of your body than developing breast cancer. That said, your final message to our viewers about preventing or catching colorectal cancer early?
Sure. So screening is crucial for early detection and prompt treatment of colon and rectal cancer, especially with the COVID-19 pandemic. We're seeing later stage diagnoses, and that's impacting specifically our younger population. So please contact your healthcare provider to undergo your screening colonoscopy.
And Dr. Daly, the direct correlation between early detection and waiting and not getting that screening when you should, when you have signs?
So increased screening can lead to detection of precancerous polyps that can be treated right then and there. If we aren't able to detect those, they can progress to cancer that can then spread to other sites, and it's much, much more difficult to treat.
And that is the reality and the importance of screening, regardless of what your risk factors are, and having that conversation with your doctor. Doctors, thank you for your time this morning. We really appreciate it.
Thank you.